The following individuals and families are examples of people who participate in a consumer-directed model called IHSS here in the state of Colorado. Please enjoy the following video series.
Circumstances, maybe your life prior to the enrollment in the IHSS program, and then what it's been like since you've been enrolled with IHSS and People Care.
Well, Dawson was born in March of 2009, and at that time I was working as a teacher, and my husband owned his own business. And so when Dawson was born with his severe needs, we needed somebody home with him 24 hours a day. So I had to keep working because I had our family's health insurance, and we couldn't get it because of all the pre-existing conditions elsewhere and with Tony's business. So Tony gave up his business, and then I stayed working so we could get our health insurance. But you know, that's an expensive endeavor. We're working alone, so we ended up blowing through all of our savings. We had to declare bankruptcy in 2010, and we finally got enrolled in the program. I think we started in November of 2011, where Tony was getting paid to stay home and take care of him. So up until that point, we had burned through our savings. Our family was helping to support us. We were looking at having to probably sell our house, which with the crash of 2008, we would have sold it for a loss and then probably move in with our parents that live nearby because it just wasn't going to work out. So it really changed our life incredibly and made it possible for us to stay here where we live and not have to sell our home and that kind of thing.
Very good.
So it's been incredible.
Talk a little bit about what the program has meant to you in terms of how we interact and the utilization of the program.
Oh, sure. It's fantastic. We have meetings probably every 2 to 3 months with a nurse who comes to check in on things and how he's doing, how things are going, if things need to be adjusted. Our care plan gets updated every year with different things. So, you know, originally he wasn't wheelchair bound because he was too young, and so as we've added his wheelchair, things have changed within our own plan, but it's all customized to what Dawson needs and where he is. And then we do trainings once a year and kind of check in with the office. We fill out timesheets every week and submit those in, and just everybody's been so great to work with, calling to check in and how things are going, and so it's been really fabulous.
Thanks. What other community resources do you utilize or have you utilized?
There's a Mountain Valley Developmental Services in the past, and they coordinated his birth to 3 physical therapy and occupational therapy and that kind of thing, and they had a little bit of not quite grant money, but money that they could give to families if they needed something. And so we applied for that once and bought him a pulse ox machine to monitor his oxygen and his heart rate overnight, and it alarms. So if we need to wake up and help him out in the night, we can do that. So we use that a little bit, but we haven't much beyond that. When he was first born, there wasn't even a pediatric home health care nurse in our entire county, and so we've always done everything. And there may be things out there that we just don't know about because we've always done it ourselves and don't know any different. So
okay, good.
Yeah.
So for those that will be responsible for changing healthcare reform in Colorado, talk a little bit about what you'd like them to be aware of as they move forward and what kinds of things would be important regarding this program and you as a consumer.
Well, keeping it for sure would be important. There's also, when we first started out, the system in Colorado was not based on sort of a triage situation as far as who needed the most help and the most support. It was based on who was born first in time, and so he would have been on a waiting list. There were children that were turning 18 before they could even get services because they were born at the wrong time. Basically, he was number 525 on the waiting list when we first started, and so things have started to change. But maybe just keep that in mind, because you know, someone who's able to be potty trained, who's verbal, who's you know, can sit by themselves and that sort of thing, maybe don't need quite as much as immediately as other children like Dawson, I think. So to keep severity of issues in mind as well.
Good, good. As you know, this is a consumer-directed program, and so talk a little bit about how you feel, how your needs have been considered in this program as a consumer.
Oh, absolutely. We're definitely a member of the team, and the company is fantastic about saying these are things that we have available. This is what we could help you with. Would that be of interest to you? You know, or we say this is what's going on with him. He's got this new, therapy coming in, or he has this new device coming in, or whatever it is, and then how can we work together to incorporate that? So
Good. Okay.
Yeah.
Is there anything you'd like to add in terms of how the IHSS program has improved your life, or any other comment you'd like to make?
It's just been completely life-changing for us. We actually, my brother-in-law had bought a bottle of champagne when we first had Dawson, and then with all of his sort of birth trauma and being airlifted in the NICU for a month, we had never opened it. So we opened it the day we found out that we were going to get the IHSS program, because it was just a lifesaver for us. So,
Good.
yeah.
Thank you.
Thanks.